I was in the 8th standard and I happened to see a movie. There was a woman who was in an accident, and in that movie, there was a really long road of rehabilitation, and she ends up becoming a pilot. If I could give one person back that ability to be able to take care of themselves, and she spoke about the physiotherapy and the rehabilitation, and that just clicked. People would say that, oh, you should follow your dream, do what you love, especially when it comes to your specialities. But with the competition that is there in the Indian scenario right now, it's many a times you do what you get. Physiotherapy wasn't so known or recognized initially. Many people would come and expect a massage from you or light treatment. In fact, even today, many patients would come in and refer to the female staff as sisters and look to a male person and say doctors, or see the therapists and ask us directly on our face, okay, but are you also really supposed to be called doctors? Medical is a field you have to love, because the dedication of time you're putting in and the expectation you have of what happens at the end of it, you are well above an age where your friends are earning double of what you're going to start with. So if you really don't love this, it's not something that you should be killing yourself over to do an entrance test for. I have kids, and as a person in the medical field and knowing so many doctors, I not only would not push them, but if they were interested in it, I would really try to talk to them in a way to tell them that this is the reality. Be sure this is what you want. You see a lot of negativity, a lot of sorrow, a lot of pain. And if you can't channel it out, you carry it. And that carrying it not only affects you, but it'll affect everyone around you. Respect is earned, not demanded. And that only comes with a lot of hard work, dedication, and sincerity. So if you're coming into the field, there will be a lot of hurdles. There still are. And don't be disheartened. If this is what you want, the universe will conspire for you to have it.
Hey everyone, welcome to DiscoverU Career Journeys. This is the place where everyday professionals, entrepreneurs, and even students share the moments that define their career paths, the victories they smile about, and the tiny steps that made all the difference. We'll bring you honest and inspiring conversations with career changers, coaches, HR leaders, and yes, even those who reinvented themselves during midlife career transitions. As a friendly community for anyone seeking career clarity, we bring you inspiring real life stories plus expert tips you can actually use. So grab a cup of chai, settle in, and let's kick off an honest chat packed with simple, powerful advice to help you chart your own career journey. Hello and welcome to Discover You Career Journeys. Today we're honored to be joined by Dr. Simone Mitchell, Head of the Department of Physiotherapy at Holy Spirit Hospital, Mumbai. With over 20 years of experience in healthcare, Dr. Mitchell brings a wealth of insight, leadership, and dedication to her field. Raised between Bahrain and Nagpur and now based in Mumbai, she is the first physiotherapist in the family, a true trailblazer. Over the years, Dr. Mitchell has not only built a distinguished clinical practice, but has also played a pivotal role in training, mentoring numerous physiotherapists at the very start of their career, many of whom credit her for shaping their professional journeys. A graduate of Ravi Nair Physiotherapy College in Sawangi, Wardha. She has earned multiple international certifications, particularly in orthopedic and vascular physiotherapy techniques. A decade ago, she became one of the few practitioners in India to receive an international certification in lymphedema therapy, well ahead of its widespread awareness in the country. In 2023-24, she was recognized as Best Doctor of the Year at Holy Spirit Hospital, an award that reflects her consistent excellence in patient care and departmental leadership. Beyond her professional accomplishment, Dr. Mitchell enjoys listening to music and cooking, both of which offer her relaxation and creative expression. Dr. Mitchell, thank you for taking the time to be with us today. How are you, Simon?
Doing good. Thank you. It's a pleasure to be here.
Great. Before we dive in, can you tell us a bit about where you are today in your career and what a typical day looks like for you?
Well, right now, as you had mentioned, I do head a department in the hospital, so we have a lot of things going on in the day. My usual day starts at around 5 a.m. So I like to get up early. I like to get a head start, spend a little me time and a meditation, figure out what's happening the rest of the day, schedule things, and tend to the family, get an idea what's going to happen at work the following day. So I like to get to work early. My duty starts at around I'm normally in the OPD at around 7:15. So OPD starts at
Okay.
7:30. I'm there ahead of time, and I'm there till around 3:34. And post that, we have the day after that, the rest of my leisure time and my kids and my family.
Yeah. Okay, that's great. So let's rewind a bit. What were your earliest memories when it came to your career? Did you always see yourself being a physiotherapist?
I was in the eighth standard and I happened to see a movie. I don't remember the name of the movie. There was a woman who was in an accident. She happened to become paralyzed waist down. And in that movie, there was a really long road of rehabilitation. And she ends up becoming a pilot. So when she comes back to the hospital to, show what happened and, to thank everyone,
Yeah.
she mentions that, the most intimate thing of not being able to go to the washroom on your own was taken away from her. And to get somebody to give you that back. I was in my early teens and I was like, oh yeah, that's an independence, or that's something that if you I can't imagine somebody taking that away from you. And if I could give one person back that
Yeah.
ability to, be able to take care of themselves. And she spoke about the physiotherapy and the rehabilitation, and that just clicked. It was like, okay, that's what I want to do. So that's how physiotherapy came into my mind through this movie, and I was like, okay, so let's make it happen.
Okay, I'm guessing these were some of the moments while growing up that kind of made you feel that this is it, this is what you want to do. But then obviously the journey was, it's not that you suddenly finish your 10th and 12th and then become a physiotherapist. The journey is long. Um,
Oh, yeah, yeah, it is.
was there anybody in your family or a mentor or like a teacher to guide you early on to get to this profession, particularly?
Um, I wouldn't say to physiotherapy particularly that there was anybody who was already in the field. It was relatively new at that point of time. People's awareness of physiotherapy was quite less. But my brother did join the medical field, so he was maybe 2 years ahead of me, and I suppose I was interested in the medical field because of that as well. But physiotherapy per se was kind of just already, I had some inkling in my mind that that was something I'd like to do. And then while I started working and as a therapist, there were people along the way, definitely. I was in college when I met Dr. Ali Irani in a clinic or a workshop. He was one of the physiotherapists for the Indian cricket team at some point. So he heads the Nanavati physiotherapy in the physiotherapy department in Nanavati Hospital in Mumbai. So at that point of time, I did come and spend some time in Nanavati working with him, and yeah, he gave me a lot of drive to push myself to work harder and to do well as a physiotherapist.
That's great. Um, I'm going to unfold your career journey a bit for the audience.
Okay.
And so, right after completing your Bachelor of Physiotherapy, where did you start working? Were you in a hospital or a clinic or a sports kind of Medicare or anything like that, like a sports center?
Actually, from Nagpur, I came directly to Mumbai. When I came here, I did a small observership, you could say. We used to call them observerships in Holy Spirit initially, and then I did one in Nanavati. And so maybe 2 3 months I was volleying between the two places. And in between that, I also picked up private patients. So we go to people's homes, rehabilitate them, those post surgical and things like that. And from there, a vacancy opened up for a temp job in Holy Spirit. And after I got the temp job, they liked my work, I liked the atmosphere, and I stuck on.
Okay, that's great. Do you feel like the years or the time that you spent in Nanavati shaped or kind of had a very strong effect on how you look at physiotherapy now? Was there any, obviously you had a great mentor at that point of time in Nanavati, but anything that shaped your approach down the line when you started off?
Well, there was a lot of competition in Nanavati. I mean, there are a lot of therapists, and now they finally opened a college as well. So there was everyone trying to get their own way and technique seen. Everybody wanted to be seen by the boss, obviously. And, that degree of competition was nice. It was healthy. It all let us grow in our own way of what kind of therapists we wanted to be. And it put a lot of drive in us, I would definitely say. And the constant need to learn and to update yourself is definitely something that is there between the staff of Nanavati at that point of time when I was there. And it gave me that drive. So, yeah, I think that helped me try to keep myself updated as time went on.
Yes, I know you've earned multiple international certifications, especially in orthopedic and vascular physiotherapy. And you've also were the first one in India certified for lymphedema therapy. Is
Not,
that,
not one of
am
the
I
first,
saying it
one of
right?
the, I wouldn't say the first, but definitely in the first batch of 50, you could say all over India. You could say that, yeah.
And before it kind of got widely recognized,
Yes, true, true,
obviously.
true. Yeah.
Okay. Um, how did pursuing these certifications shape your career?
So yeah, in physiotherapy there are various techniques you can use, and there's always something evolving, and we're coming up with, which we start when we learn in our college level, but then there's finesse put to it as time goes by, and doing them really helped me clinically. I'm basically more of a clinician as compared to an academic, I would say.
Hmm.
So clinical scoping and the techniques help in treating patients, and that was my main aim. The outcome measure.
Okay. My next question is about kind of three or four concrete steps someone today could take from an undergraduate training to a specialty certification to build a similar path. Would you have any three or four concrete steps?
In a ideal situation, people would say that, oh, you should follow your dream, do what you love, especially when it comes to your specialities. But with the competition that is there in the Indian scenario right now, it's many a times you do what you get. I mean, that's the same thing as when we were qualifying for physiotherapy, or many of my batchmates when I studied physiotherapy. They took it because they didn't get medical or dentistry. They gave the PMT turn to MHCET. That's a Maharashtra Common Entrance Exam, which a test which has now become NEET. And at that time, it was like whatever your ranking was, you decide if you're willing to just compromise and take what's the next thing to be in the medical field. And many of them didn't really want physiotherapy or know physiotherapy, but they entered because that's what they got. And similarly, when you're trying to do a super specialty, many therapists want something and like it, but that doesn't mean that the seat will be available, and you kind of maybe have a tendency to compromise down the road. But in all, our basic bread and butter really stays the same, as most therapists would. Any therapist would know how to treat a backache. Maybe the speciality into it or the advancement into it would change, but like I'm saying, that's how the things went and how the things go. It's what you train yourself to do, how long you're willing to wait for what you want to do, and whether you can curb your interests into liking something you get.
Professional growth, um, Simon, often comes with hurdles. What were some of your toughest challenges while entering into this career and doing this specific course 20 years ago, or maybe more?
Uh, so, physiotherapy, like I said, right, wasn't so known or recognized initially. I mean, many people will come and expect that, okay, to massage, I'm expecting a massage from you, or, I've come for light treatment. And those are things that I still hear today sometimes. Doctor sent me for light therapy or something like that. So the awareness is quite poor into knowing what rehabilitation actually is. And that's kind of sad, especially with the amount of media that we have available to us at this point of time. And that was one of the things that people didn't know what it was, or they thought of us like either masseuses or fitness trainers. And that is something that was hard to break through. And then the next hurdle was that we weren't considered so much a part of the medical field, as at that time it was paramedical. Now we're coming into allied, which is something that registrations
Yes.
and councils and everything are changing now. So that's a growth in progress. So it came into where the government, or we started being called doctors. And that was even something that I had to fight for within my own hospital, and try to make it known that, okay, this is something that we are now recognized. It's, take out documentation, show them that this is how things are now. And it was a hard transition to come to that. In fact, even today, many patients would come in and refer to the female staff as sisters, and look to a male person and say doctors, or see the therapists and ask us directly on our face, okay, but are you also really supposed to be called doctors? So, where in places like UK and stuff, there are postings where therapists are your first line consultant, the first person that you meet when you're having an injury. Where here,
Yeah.
doctors still push that, okay, after you refer through the channels of your normal medicals, like your orthopedics or your neurology, and then you go see your therapist. So it's different in India and abroad, and there's still some hurdles that we're tackling.
We're talking about metros that are
Oh,
having this
yeah, we're talking
conversation.
about,
I can't even imagine the smaller towns. Um, I mean, I wouldn't even imagine what that scenario is.
what the funny thing is? The smaller towns, uh, to a great extent, there's more respect from patients in smaller towns. Honestly, from what I've seen over the years, people in metro, they now come off as being, I think, graduates of your WhatsApp university, and they'll come to me with a diagnosis. So we already have an air of, okay, I know what's going on, so you just have to do what you have to do types. And it's become very commercial. It's really commercial now. It's, you're paying for a service. It's not that you're the doctor, or I'm not saying that I'm above anyone and I should be put on a pedestal. No, no. Everyone, every professional has a degree of respect. I mean, abroad, even a driver is dealt with a great deal of respect, which, I mean, sometimes we don't see everywhere. So that is something where uh, a small town, still to some degree, you would feel some reverence that a patient would give you. There's some degree of trust, and when there's a degree of trust, you see results way faster in a patient when they feel that you know what you're doing and they're coming to you and just putting it in your hands. Here, what happens, and on occasion, that patients come and they have already an idea of what they want from you, and they're not too keen on hearing maybe what you'd have to give. Like, I've had people come and say things like, now, alternative therapies. I like to say that there are a lot of fads upcoming. People get bored, and things like your Michael Phelps started the cupping phase, and everybody wanted like these big round bruises all over themselves, to show that, oh,
Yes, yes, and
yeah,
these
yeah, okay,
little
okay, so
bandages,
now,
bandages everywhere.
yeah, you can tell that's one of the things I'm not a fan of. But I'm not saying it doesn't help. I'm not saying it doesn't help, but you'll feel people who come and say that, oh, I want cupping done. I've seen another therapist. I've got needling done. Can you do needling? And it's not that, what is your expertise? What do you think I need? It's okay. I think I've pulled a muscle. Can you stretch it out? Or just teach me an exercise. I'll do it at home. It's the attitude changed from saying, okay, you just massage, or you're a fitness trainer, to a different level post the access of internet. But that's in a small degree of patience. This is when you brought up the whole metro thing where this came to my mind.
That's great. Thank you for sharing that because I think it's very
Yeah.
important, especially to our younger audience to probably consider getting into this field. And having said that, I do want to come to a very interesting topic. And in your opinion,
Mhm.
um, what does the trend of repeated NEET, and for the audience, NEET is now compulsory for you to get into the medical field. It's an entrance exam. Am I
Right,
right? To
right.
get into the medical
Yes,
field.
yes, it is.
And
Yeah.
yes. So, what does the trend of repeated NEET attempts say about students today? Do you think family or societal expectations sometimes leads to unnecessary pressure to crack NEET at any cost?
Yeah. Um, it's a little different now, I think. When I started, I was the first batch of Maharashtra Common Entrance Test. Before that, it was PMT, it was pre-medical test. So that time, pre-medical test was only for medical. Maharashtra Common Entrance Test was for your medical, your engineering, your whatever, everything it is. And I think NEET covers national level. So obviously, that's way more competition. I think there was a limit to how many times you could apply at one point. I don't know if that still stands. As for it
I
being,
have
it depends who wants to do
students who
this
have done 4 attempts.
four
So
attempts.
I'm
Yeah. So I mean,
definitely
see, it
worried.
it really one is if it's the person wants to do it. I mean, if you're that desperate that you want to get into medical personally, you it's a field, medical is a field you have to love because the dedication of time you're putting in and the expectation you have of what happens at the end of it. Let's be very honest, and not only for the physiotherapy field, but I can tell you most medical fields as well. You are well above an age where your friends are earning double of what you're going to start with. And you would have killed yourself studying all those years and maybe not enjoying your 20s. And then get into a field where you're just starting off. And, the money
Yeah.
won't flow as well. I mean, that's something that we've seen. So if you really don't love
Yeah.
this, it's not something that you should be killing yourself over to do an entrance test for. And if you're doing it for somebody else, well, that's a way bigger conversation. I think there should be a good talking of what the expectation is from both parties, your parents as well as yourself. I mean, I have kids. And as a person in the medical field and
Yeah.
knowing so many doctors, I not only would not push them, but if they were interested in it, I would really try to talk to them in a way to tell them that this is the reality. Be sure this is what you want. And
Yeah.
repeating it for a number of times. See, everybody has a particular level of uh, application of their intelligence and knowledge. Like I said, I think I said it earlier. I am more of a clinician. I'm not a great academic. Okay, I wouldn't even want to do my PhD if you handed it to me on a platter. I don't really I like to use evidence based practices, but it's not that I would go and research to come to that evidence. And so if you go to see that way, so what I'm saying is that when you do an exam for a particular number of times, understand that every year goes by and the competition changes, the rules and regulation changes, syllabus of your 10th and 12th is changing. So what you're trying to do every year, it's getting outdated. I mean, right now, there are therapists who have passed 2, 3 years ago and have experience. And I could say that maybe at some point I might find myself, despite my experience, trying to come up to their level by discussing more cases with them because they've got an insight better than me. So it happens because everything's evolving. And if you're trying to spend so much time trying to get your footing in, I wouldn't personally think that it would be worth it. And also at that point of time, when I did my exam, we were competing for very few seats because there were so many categories in it. I mean, there's your OBCs and STs and SCs and your open categories and your domiciles. In fact, my brother tried to do the pre-medical test is when we just came from Bahrain. So he was in the country for 2 years. That was his 11th and 12th. We had to give a domicile certificate so that he would be applicable to give his medical entrance exam. And I don't think it was accepted at that time. So he wasn't allowed to give his medical entrance exam. Now, going off the topic a little, my brother was brilliant. He gave, I think, two medical colleges exams, and he passed both of them. So one was Mahatma Gandhi Medical College, that is in Sevagram, and another was St. John's in Bangalore. So he got interviews for both of them. So what I'm
Yeah.
saying is a person that brilliant who got merit seats was available to go for interviews to two colleges if he was allowed to give the PMT. Imagine where he would have been. So, I mean, what I'm saying, trying to say is that, you have to look at the level of every year passing by, what you're applicable for, what you can get into, and it changes. And then you're going to look at the places where there are the St. John's interview. If I can add on that, is that there were only two seats, and there were, I think, 15 people competing for those two seats because he was non-Karnataka Catholic. So there were only two seats for the non-Karnataka Catholics, and he was 15 people had to give that interview. Now, that's the level of competition, and the population's increased. No doubt colleges have, but the
Yes,
population
I
has
was just going to
increased.
say the population has
So the
increased. So,
competition is maddening. I mean, I honestly didn't break myself for the entrance test. I knew what I wanted. I only did a year for a year class for the entrance test. And I mean, I
okay,
didn't burn too many midnight lamps for that one either. But yeah, so yeah, that's a lot about the entrance
great.
exams.
Okay. No, but the reason why I'm even diving into because when I work with a lot of students and I work with students across the country and a lot of people come to me and they're about 22, 23, and the first thing they'll say is that I've done PCB and the moment I hear PCB I have to say okay, so what next? And they'll say medical stream, and I've looked at their age and I'm thinking, and the immediate question is how many drops, and they'll say 3 drops, 2 attempts, or 4 drops, 3 attempts, or we're right now attempting the next NEET and we're not sure. And there's fear. There's a lot of fear because and you're in a leadership role right now, and you also probably work with younger physiotherapists who are probably interning or just starting off. But there's a lot of fear. If I don't do this, what's going to happen to my family? Or
Oh, yeah,
everybody in my family is a doctor. And like you rightly said, it's the dedication of those many years that you need to give in the medical field. It's not about, oh, I'm finishing my MBBS and now what? Oh, yeah, I'm a doctor. No, it's the dedication of those many years. And post that, the hurdles and the, constant battles that you have to kind of, and obviously there's the great part of helping and making a difference and making someone's life better. But there are all of these factors
absolutely,
which
absolutely.
we have to kind of take into consideration, and you being a mom yourself, and like you rightly said, it's about just being aware and just telling them that, you need to know the truth and then make a decision
You have to be well
about
informed.
this. Yes, absolutely. So, yeah, now you are in a leadership role at the hospital that you are in. I think, are there any mindset shifts or any habits or any tools you kind of use to go through the day, to go through all the hurdles, to kind of keep you going because you come back home and you have a second job, which is being a mom. So there's all of
Yeah.
that.
Oh, yeah, yeah, yeah. So, I mean, to reach their own, you have to figure out what suits you in calming yourself or kind of being able to focus better. And, it's something that we need to take a step back many a times. When we're into something so deeply, you need to take a step back and try to refocus. I think all of us are very familiar with taking, pictures on our phone. When you're too close to something, how blurred up it gets. And sometimes you just need to refocus and figure out what you're looking at. And okay, so that was my concentration. I was at this place at this point of time, and I'm focusing on this particular patient. And now I switch it off because there's a lot you need to switch off in the medical field. You see a lot of negativity, a lot of sorrow, a lot of pain. And if you can't channel it out, you carry it. And that carrying it not only affects you, but it'll affect everyone around you. And that's something that you really need to know that if you are strong enough emotionally or you have the emotional intelligence, you need to get that sorted. when you're learning to get into a field like this. Because in physiotherapy, there's a lot of counseling involved. You spend a lot of time with the patient, more so than the consultants do, than your orthopedics or your neurologists, because they're coming to you for a longer period of time. They'll spend more time with you. They'll talk to you. And many a times you learn of stressors, psychosomatic pain. A person had
Mm,
pain, they're not responding to everything, and they'll just suddenly start talking about how stressful work is or how things are just not working out with them. And that itself also to a great extent alleviates pain when you have a ear to listen. But when you listen, where you take that, what are you doing with that? And personally, you need to know where to put all that information. So there's a degree of dissociation you learn, at least I've learned over the years, not to bring it home, and how to refocus and regroup and learn and apply things as well, because there are so many things patients have taught me. I've met some fantastic people, and as much as they talk, I talk back. So, we learn about each other, and they will share things that have helped me in my life and with my kids even. So I could tell you that, yeah,
yeah,
definitely yeah, it's a growing experience. Life is a growing experience, and there's a lot to give and take from everyone you meet.
absolutely. Um, some kind of practical takeaways here. As being in the field for so many years, being in the leadership role, constantly having to update and upgrade yourself, working with a different generation altogether. If someone is at a crossroads or a career crossroads and considering physiotherapy, what small steps or hands on experience, like volunteering or shadowing, or would you suggest before they apply to NEET? And I know yours came from that I want to make a difference and I want to kind of do this, but anything here?
Well, yeah. If anyone's, I mean, like, if you have someone who's interested in the field and not too aware, it is something nice if they could, like, join a small clinic setup. Hospitals are difficult. Hospitals, there are too many rules and regulations to break into, and you may get too overwhelmed. But I would say that the one-on-one interaction with therapists, I mean, not that you would interfere into it, or you to just be a observer, and you could maybe get into a clinic where you could observe how uh, they assess patients, what is the procedure and protocol of how it starts with meeting a patient, just the conversation, getting into their histories, the examination, coming down to a treatment plan, what is their goals. Somebody may come to you and say, okay, I want to learn to throw better, but I'm having pain when I'm throwing, I can't figure it out, and their whole focus is their shoulder, that they're not able to throw, but you realize that somewhere down the line it's actually their back, their glutes not functioning enough, they're flat footed, something's turned off, something needs to be turned on, and you're focusing at a different part of their body, and they're like, but my aim is I can't throw. And it's interesting with the human body, and how you have to learn to come up with these things. And that's if you shadow a person in a clinic, I think if that's the thing you like to do, you'd really learn how to, you'd get into it, definitely. Of course, there are different fields. I'm just talking about the orthopedic aspect. I mean, neurology is also extremely vast. And I mean, there's so many different things. So, women's health has become huge now. And
Yes.
they're all right. I mean, cancer rehabilitation, onco rehabilitation is also big. A lot of patients being diagnosed with cancer now, and their techniques to help them rehabilitate. It's something. I mean, the internet is vast, and there's a lot of information you can get. So that's also something that looking online and trying to find out what streams are there in physiotherapy, or what kind of patients, or what are the kind of outlooks or goals that you have and interests, and try to do it, develop and get some research on it.
Do you keep kind of updating yourself with like new techniques or evidence-based practices or any continuing education at this point of time? Are you on the go? I'm
Absolutely, absolutely. Whenever I can. I mean, it gets difficult at some point, and I like to tell my staff, as well as I like to myself, try to do at least something every year, if not two, three courses, or if not courses, there are workshops and there are conferences and CMEs. I think just last month I attended an orthopedic conference, an orthopedic conference. So that was something that I had done recently, but that's just to learn what's out there in the field, to get different views and different techniques from your other peers as well. And I remember when I had done this the lymphedema certification that I had done some years ago.
Yeah.
At that point of time, my kids were like 2 and 3 or 3 and 4, something like that. And every time I had seen the material that was there to study, and the only thing I kept on getting back to the course instructor was that I'm not sure how much I can do. Can you've given me a deadline? I don't know if I can complete the deadline. I've got two babies, and I'm this and I'm that. And when they had the hands on, and I had to go to Tata Hospital, the Cancer Institute, we had our hands on there. And when I went there, the instructor took my name, and the introduction for me was, oh yes, she's the mother of two. So it was so much anxiety and stress that can I study and can I do this, because you have to, you have to, you will be outdated, and you will, lose things if you do not update yourself. And like I said, cupping became a fad when I was well into practicing, and now needling,
Yeah.
taping there, myofascial release and lymphatic massages for sport pairs. You need to be there with everything, up and at it.
Yeah. Great. Um, Simone, is there a book or a clinical insight or mentor's advice that has stayed with you throughout your career?
Well, I think many therapists would agree that there is physical rehabilitation. Susan O'Sullivan is like one of our Bibles. Like it's a nice big book, like a Bible. And yeah, that's one of the physiotherapy books that, I mean, all of us swear by. All our bachelor degrees, everyone's got that. I think they're half of the time we're trying to sleep on that book and hoping by osmosis something will get in passively if we're not reading it as well. So yeah, so that is one of our great books. And if you say guide for inspirational books on getting into the profession, I don't know of any books that way. Maybe I'll write one. So let's see what happens
Yeah.
down the line.
We're all looking forward to that.
Thank you. Yeah.
And any one or, maybe many, maybe one or two decisions, big or small, that you are particularly proud of?
Becoming a therapist for sure. I mean, that was one decision. I Since I've been heading a department for a good decade now, I would say that there was one thing that I'm very keen on uh, keeping up the team spirit, and in the department, in my unit, the physiotherapy unit that we run, it's very important that we have team efforts and a very positive outlook. I mean, I love it where we have this personal rapport, that we see a patient walk in and all of us are like, oh, hi, how are you? What's happening? Even if they're walking in pain, we need to see that, that brightness.
What's your top piece of advice for young physiotherapists or students entering the field?
So, top advice. Normally at work, whenever I happen to leave, my main thing I tell all my staff is, don't burn the department down. I think anyone who's worked with me will have heard me say that. But most importantly is, I always tell them that you got to be sincere and work hard, and don't be beaten down by things, because this profession is still growing, and many a times there's a lot of disappointment about where we are and how we have to grow. So hard work is really, really the key. And don't be beaten down. Many people approach not only physiotherapy, I've seen in many fields where they come in expecting to be respected off the bat. I'm qualified, and now I'm a professional, and you should get it, and I should get all the following, and you should understand what I'm saying immediately and respect me for it. And respect is earned, not demanded. And that only comes with a lot of hard work, dedication, and sincerity. So if you're coming into the field, there will be a lot of hurdles. There still are. And things are still trying to regulate. There's a council, national council being made for physiotherapists. It's gaining a lot of speed right now. And that is something that's still upcoming. So if you're getting into the field, the regulations and the rules and things are still changing. You got to persevere and don't be disheartened. If this is what you want, the universe will conspire for you to have it. I'm pretty sure that's from The Alchemist. So, yeah, that's about it.
Okay, great. Thank you so much, Dr. Mitchell.
Most
Thank you
welcome.
so much. And I am I know that this video is definitely going to help our audience, and it's such an important subject. Hopefully, we'll get to chat again, and I'll get to chat with you more about this offline and online. But thank you
Surely.
so much, and I really appreciate you taking the time out to do this. So, thank you so much, Simone, for sharing your experience and your journey with us today. I'm sure this will inspire our audience. I wish you all the best on your journey ahead. To our viewers, we hope you found this conversation insightful. Stay tuned for more episodes of Discover You Career Journeys, where we aim to bring you inspiring stories. At the end of each career journey, we bring you key learnings from our conversation with the guest. Here's what Dr. Simone's journey taught us. Inspiration can come from the most unexpected places. Sometimes a story, a film, or a real life encounter can plant the seed for your future path. Along the way, the right mentors can ignite your drive, challenge you to grow, and shape the way you approach your work. No matter your field, continuous learning is essential. Staying updated through new techniques, certifications, or workshops keeps your skills sharp and relevant. At the same time, it's important to remember that the pressure of entrance exams, while common, can often create unnecessary stress, and one test should never define your worth. Before you commit to a career, shadowing or observing professionals in the field can help you see its realities, the demands, the rewards, and whether it truly excites you. And while following your passion is important, being adaptable allows you to make the most of opportunities that come your way. Hands-on experience is invaluable. Real-world practices teaches lessons that theory alone cannot. And finally, perseverance is key. Every career will bring hurdles, but resilience, hard work, and a positive outlook can carry you forward. Thank you for watching this inspiring conversation on Discover You Career Journeys. If you've enjoyed this chat, hit the like button and let me know in the comment section which part of today's story inspired you most. And if you have questions about your own career or want to hear from people in a specific industry, drop those suggestions below as well. Don't forget to hit subscribe and ring the bell so you never miss a new career journey. It may just be the inspiration you were looking for. Until next time, stay happy.